Hello, this is Dr. Wickham Simonds. I'm an obesity medicine specialist in the Triangle area of North Carolina. This is Obesity Medicine Perspective. Now, we've done a number of videos prior to now, and we've talked about several different subjects, so I just kind of wanted to do a little review of some of the things that we talked about, just to refresh your memory about some of those things we originally talked about that you may have forgotten about. So I kind of started this whole thing out trying to educate patients and providers about the disease of obesity. So the first concept was that obesity is a disease of excess body fat, and that the thing that really causes you to store body fat, your body's fat storage hormone, and this is the second main point, is insulin. So obesity is a disease of excess body fat. It is controlled by your insulin level. Now, your insulin also controls your blood sugar. So if you eat a lot of carbohydrates, what's going to happen is you're going to have a higher blood sugar. And to keep you from getting diabetes, you will make a lot of insulin. And it will control your blood sugar in most cases. The problem is that it's also a fat storage hormone. So if you're going to eat a diet that has a lot of carbohydrate in there, you're going to have a lot of insulin and you're going to store a lot of fat. And so kind of the third point then is the therapies that we come up with here at my practice, both diet and medicinal therapies, are designed to bring people's insulin level down because we want that fat storage signal to go away. And when that goes away, you lose weight, and you lose it in the most appropriate parts, in particular in your belly. So the kind of the fourth concept is that this excess body fat, and in particular this visceral fat right here in your belly, can act like a gland, and it can produce a lot of chemicals that are very negative and that produce disease. And this is kind of how you end up with things like type 2 diabetes, lipid problems, plaques in your arteries, hypertension, a lot of diseases that we are familiar with here in the United States. So again, when we talk diet here in this office and when we talk about medicine, we're trying to get right to the heart of this issue and target insulin as our main target of treatment. If we can get that under control, then we can get your body fat under control, your metabolic parameters will improve, and your weight goes down. Now, we've talked about different medicines, and I haven't covered all the medicines that I prescribe. I've just covered a few, but you know, some of the medicines we've talked about as an appetite suppressant like phentermine. We've talked about most recently Belviq, and Belviq is a drug that produces fullness and satisfaction once you start eating. We've talked about metformin. Metformin is a pre-diabetic drug that acts by lowering your insulin level and can be a nice adjunct to your therapy. We've talked about, in terms of diet, restricting carbohydrate intake. We talked at some length about that, and so I'm not worried that you're going to eat too much protein, too much fat, or too much vegetables. I am quite concerned that you're going to eat too much sugar, flour, and starch, as I always say. And so those are the things that I really talk with people about. Now, all of this stuff has an impact on your body composition, and I want to get that weight to come down because you're losing body fat. So I've talked about a very nice body composition assessment device that we have here in the office called the InBody 770. And the InBody is very precise, and it gives you a detailed report of your body lean mass and your body fat mass by anatomical area. So in each arm and each leg and in the trunk, and you can track the results that you're having from going on a diet and taking medicine and exercising. And so it's a great way to see exactly what's happening, and it's great feedback for people who want to see results. Now, because it's kind of a foreign concept, I'm giving some of those away, and all you have to do is follow us on Facebook, follow us on Twitter, follow these videos, tell the office staff they can schedule you a time to have it done. It's a simple and easy test. You can go back and watch the video of Tallahassee Bill doing this test. It's simple, it's easy, and that'll show you exactly what's involved. So, it's been great talking to you again. Don't forget these concepts. We're going to be doing more videos. Keep watching. Until then, I'll give you the tools, you give me the effort, and together we'll overcome obesity.